Welcome, everyone. We will get started here just in a moment, but I just wanted to let you know that we will be taking questions toward the end of the session. So if you have any questions, feel free to put them here in the chat. If you also have any people that want to schedule a demo or receive resources about the webinar, those will be provided in the next business day or two. But I will go ahead and add a message that everyone can see. Oh, also let us know where you're from and what organization you're with. Okay, I think we're ready to get started, everyone. Thank you for attending today's webinar with Housing Forward. This is Eccovia. We are the leading software provider in the case management space. I just wanted to confirm, can everyone hear and see me okay? Just give me a reaction here if you can. Wonderful. Sounds good. All right, so we'll go ahead and get started then. Today's webinar is focused on coordinated access in Dallas and client consent and data governance. Housing Forward is the collaborative applicant and HMIS lead for the Dallas COC TX-600. So if any of you are interested, we will be providing the slides as well as the recording and a document with the questions and answer portion all laid out for you at the end within the next couple of days. But first off, I wanted to introduce you to our team. Our first presenter today is Frida Nelms. Frida is a project administrator and data management professional with 10 years of experience as an HMIS subject matter expert for the collaborative applicant and HMIS lead. Her focus is on leading cross-functional teams, training, and ensuring data quality and compliance. At Housing Forward, she serves as the Director of Data Management and Reporting, where she has led efforts that have reduced homelessness by 19% and decreased data quality errors by 48%, both since 2021. Give us a wave, if you would, Frida. Oh, yeah, we can see you already, right? Yeah. Great. And then next up, we have Phil Force. Phil serves as an HMIS administrator, leveraging his strong data management skills to oversee HMIS customizations at Housing Forward. With 12 years experience in various roles, including web design and community services, Phil thrives in collaborative environments and enjoys providing guidance, managing data, and making operations as smooth as possible. Phil, if you wouldn't mind giving us a wave. Thank you. So, what are we going to talk about today, and why are we here? Well, we know that across the United States, many communities, large and small, are still trying to improve their care coordination, specifically with their coordinated access systems in the HMIS space. So, what we're doing with ClientConnect is trying to share best practices, both with technology, but also with data governance and shared missions and values across different communities that have achieved admirable milestones in their mission to end homelessness or at least achieve functional zero in homelessness. So in this presentation, we are going to talk about how the COC is structured at TX-600 or Dallas specifically, and then we will look at how they changed their privacy policies as well as implemented a coordinated entry system within the HMIS. So without further ado, I believe Frida is first up.
Yes, thank you for that, Bryce. I would like to just start off by giving everyone an idea of how our COC is structured. I know for me, this is always helpful because as I come to, as we participate in various webinars in the HMIS space, I'm always wondering, like, how's the COC structured? What size is this COC? Because it helps me to be able to, better understand how relevant it is to me as an HMIS admin and also in our COC. So Bryce, if you would go to the next slide for me, please. This is where you're going to see that essentially within our ClientConnect database, we have about 84 security organizations. And this total includes HMIS participating organizations as well as non-HMIS participating organizations, because we do work with certain providers to get their data at least once a year. So of course we have all of those organizations set up so that we can do proper reporting, whether it's throughout the year or whether it's that one time of the year when we're doing our HIC and PIC reporting. We have a total of about 314 projects in the system as of today. And that includes every specific project type in the HMIS data standards, as well as a project type other. I say that because we allow our providers to set up a project type other, because not all of their programs at their agency require them to use HMIS, but it's important to us that we reduce the data collection burden for those providers so that they can have just one system and they don't have to do, implement another database at their agency for those projects that don't require them to use HMIS. And I want to point out that we have a single coordinated entry project. I know that many communities across the country have set up their coordinated entry system differently, but we do have a single coordinated entry project where providers enter all coordinated entry data into that project. We have about 570 users. That is increasing every year, the average number of users that we have using the database. I think back in 2019, the average number of users we had in the database was about 325. And so that continues to increase as we bring more providers on to using the database. And just some relevant information is that our point in time count for 2024 was 3,718 individuals who were experiencing homelessness on a single night in January. And that is for sheltered and unsheltered. And Bryce, you can go to the next slide for me, please. Just so that you have an idea of like the actual size of our community. Is Dallas County alone is about the size of Cook County in Illinois, which is a Chicago area. So that would be ×2, because we cover Dallas County as well as our neighboring county, which is Collin County. And that is the area that we're responsible for as a continuum of care. So any providers that fall within that geography, they use our HMIS. So I want to just continue to let you know more about how our COC is structured, and then now who's who within our COC. So we call our COC the All Neighbors Coalition, COC. And within that COC, over the last couple of years, we have implemented what we call work groups. And work groups is where we accomplish very specific tasks so that we can carry out the responsibilities of reducing homelessness in our community. My team works very closely with the HMIS work group, and in that HMIS work group, we have various providers that participate in that work group. Some of them use HMIS, some of them do not use HMIS. Some of those providers, some of the folks who participate in that work group are funders, right? So they don't necessarily use the database, but they fund providers in our community. Some of them have expertise in data or expertise in the technology itself. And so we all come together at least once a month so that we can talk all things HMIS and so that we continue to improve data integrity and help make changes to policy. With regard to Housing Forward staff, Housing Forward is the collaborate applicant. So we're the HMIS lead as well as the as well as the collaborative applicant. And we have 33 staff. Our team specifically, those who are HMIS system administrators, there are 4 of us. And how we've parsed out our work over the last couple of years is that we have, when we implemented ClientTrack, specifically our coordinated entry workflow, we worked very closely with with Eccovia, to design the workflow itself in ClientTrack. And we have utilized ICA, a particular contractor, to help make edits to that coordinated entry workflow, make refinements to that as needed over the last couple of years. And then we also use them to do our PIT cleaning and preparation and help us to submit that information in HDX. Let's talk about why and how we changed our privacy policy. We went live with ClientTrack in 2019, and it was at that time when we started to analyze data from our old database and were transitioning to ClientTrack, that there was just information that was very glaring to us that was causing a bottleneck in getting people referring people and getting them to the services that they needed that would end their homelessness. And that is with regard to how our privacy policy was structured. So before we went live in ClientTrack, we basically had 4 levels and 4 options where clients could consent to share their information. The first level is clients could not, they had the option to not consent to share at all. And that was an option in our database. If clients chose to not share their information, then only the provider who created that enrollment, and that client within the database, they were the only ones who were able to see that information. And the second option that clients could consent to share is just to share what we call some basic information. That's name, date of birth, basic contact information, and then everything else, such as the program enrollment, such as services that were being received, then the client could, that information was not shared. And this happened every time that a client went to receive services from a provider within our continuum of care. They had all of these different options where they could choose to share client information or enrollment information. The third level that a client could consent to share was related to all of the details that are related to the program enrollment. If you'll think about every project type has different levels has different data that's collected within that project type. And so that information could be shared or could not be shared. And then the next level of sharing was everything that was related to the client, enrollment, personal identifying information. The client could consent to share it at that level as well. We also required that at any level, level 2, level 3, or level 4, if a client decided that they were going to share that information, we required an actual client consent form. And that information, that consent form was to be kept in the client file. It was to be uploaded and attached to the client's record so that when we, as the HMIS lead, when we decided that that provider was going to have an HMIS monitoring, that was one of the things that we checked to make sure that any information that the client decided to share within the database, that they had a consent form in attached to the client's record in HMIS as well as in the client's file, because we wanted to ensure that the providers were only sharing what the client consented to. When we looked at this information at the time of our transition, what we realized is that we had 10,000 plus records in the database that were, 10,000 plus enrollments. That includes clients' information where clients had consented to share it at various levels. And if you think about like how confusing or how much of a headache that would be when HUD required us then to implement coordinated entry within HMIS, that we realized that caused a barrier for us to refer clients to the proper services that they would need in order to end their homelessness. And so we decided to rethink this decision, and we worked very closely with our COC. We work very closely with our providers, and we received some HUD technical assistance so that we could then decide what was the best option. So when implementing coordinated entry, that we would be able to connect clients to the services that they need that did not create a barrier. The next slide, please. And this is where we decided that we were going to transition to more of I'm using the term more of an open system. And this required us to review our HMIS privacy notice, our privacy policy, as well as our consent of release of information. And within ClientTrack, we designed a MOU release where the first change that we decided to make as a community is that every time that a client's record was created in the database, then basic demographic information is always shared. That information is never hidden. So that all providers can see that client's information, and that also helps to reduce on the number of duplicate records that are created in the database. That also lessen the burden on us as system administrators, because if a client's basic demographic information is hidden from the provider, that if a client, let me back up. If a client were to go to organization A, and organization A creates a client record and that record is shared, but then the client goes to organization B and that information is not shared, well, then that creates duplicate records. So the reason that we made a decision to create an MOU release where demographic information is always shared, because that also helped to reduce the burden for us as system administrators, so that there's always one client record in the database at any given time. We're not constantly merging client records. And then the provider can always search the database to see if there's an existing record in the system and attach the new enrollment that's been created to the existing record if that client already has a record in the database. One of the other changes that we made to how we share information within HMIS is that we implemented a structure called sensitive organization and non-sensitive organizations. And I'll explain exactly what that is to you here. Sensitive organizations, and this is outlined in our privacy policy. Sensitive organizations are any organization that is funded by HOPWA, Housing Opportunity for People with AIDS, or funded through RHY, Runaway Homeless Youth Grants. We consider those to be sensitive organizations. These are the only organizations that now require written consent to share information within the database. What does that look like? If a client presents at a HOPWA or RHY, a RY provider, that provider must have a intentional discussion and pull out a client release of information form and have a discussion with the client about what it means for their information to be shared in HMIS and what it means for their information to not be shared in HMIS. The client who's presenting at a HOPWA or RHY agency can decide that they do not want their information shared, and therefore, if they do not want the program enrollment information shared within the database, then when the provider creates the enrollment in ClientTrack, the provider selects an option that says restricted. What that means is that no other provider out of all of the security organizations that have access to HMIS, no one will see the enrollment details for the client. No one will see that this client is participating in a program at this HOPWA or this RY agency. If the client does consent to share their information within HMIS, the client must sign a client release of information, and this is for every client that's participating in the program. So all family members in the program, we have to have a client release of information for each person. And when that client decides that their information is shared in the database, then the only providers that can see the program, the details of that program enrollment are like organizations. For example, clients who are being served, receiving services from a HOPWA program, their information is shared, their program enrollment details is shared within the database. Only other HOPWA providers can see that that client is receiving services from this HOPWA provider. The same with RHY. If the client decides that they want their information shared within the database, only other RY providers can see that this client has received services from this other RY provider. We have found that in our community that we know that there is extra sensitive information, right, that is collected, that's required for these project types in HMIS, any project types that are funded through HOPWA or RHY. We know that there's extra sensitive information that are in those enrollments, and that allows for our providers to have a very intentional conversation about if the client feels comfortable with sharing their information. Sometimes HOPWA clients who are being served by HOPWA providers, right, they don't even, they have to be AIDS or HIV positive, but those providers, that client may not have shared their status with other people who are in the family, right? And so there's still, we allow that client to have that option to keep their information secure or not shared in the database. And that's been, our providers have really appreciated that flexibility in the database. One other thing that I'll point out when it comes to our runaway homeless youth programs that we have in the database, any client that is enrolled in such a project and they are under the age of 18, all records for clients that are under the age of 18 they are not shared. They are restricted. So the provider has been trained that clients under the age of 18 cannot consent to have their records shared. We're in Texas, so we want to make sure that we follow all laws that are applicable to Texas. And people who are under the age of 18, they can't consent to share. So if a 16-year-old presents at a RHY provider and they're presenting by themselves, our providers have been instructed that that record should be restricted because a client under the age of 17 cannot consent to share. We can go to the next slide. Now I will, all of our other providers, if they are not funded through HOPWA, if they're not funded through RY, then those are non-sensitive organizations. And we ask, they're non-sensitive organizations, which means in the database, we have structured the system to where our MOU automatically identifies providers or organizations that are non-sensitive organizations. And so by nature of the end user going through the process of creating a HMIS record and creating an enrollment within HMIS, that enrollment is automatically shared. It's automatically shared with all providers that have access to HMIS. And the reason that we have structured it that way is, if you'll remember me saying at the beginning, we had 4 levels of options where clients could consent, and we found that that was creating a barrier for us to referring, or would create a barrier for us to refer clients to services when we implemented coordinated entry. And so those records are shared for all of our non-sensitive organizations. Any provider that uses HMIS can search for a client and see all of the different enrollments and services from all non-sensitive organizations that have served the client at any given point. We train our providers. Remember, a client consent form is not needed for clients who are participating at such organizations, and our providers have been trained to have our privacy notice, as well as our privacy notice posted anywhere that information is collected within their agency. They have also been instructed to have the privacy policy printed in the event that the client were to ask for it. And at the very beginning of the intake process, then that provider should have a conversation with the person who is being served, letting them know that that provider uses a homeless management information system, and that is a shared database, and that database allows for us to do many things, right? Like better understand what resources and tools are needed in our community so that we could serve those who are experiencing homelessness. And then we can also connect them to other services within our community, so that we can get them housed, and we can reduce their homelessness. And that is also how we have our coordinated entry project set up in the database. And that particular project is also shared. I will now hand it over to Phil.
Thank you, Frida. Next slide, please. So as Frida was saying, coordinated entry is a non-sensitive organization set up in our system. We have all providers use a single coordinated entry project and a single coordinated entry org. Activities visible for all the end users with access to the single coordinated entry org. So anyone who has access to coordinated entry can see all coordinated entry enrollments as well as services. And we grant access to all access points. So individual users at our shelters and other access points have access to CAS, and they can switch their org within ClientTrack to do a coordinated entry enrollment. Next slide, please. So steps involved at the access point. First, a client expressed a desire to be housed. We don't want to try to house them if they don't want to be housed, of course. Once they've expressed that, the access point providers add the client to the CAS queue. That's the CAS queue is our by name list for CAS by creating a CAS enrollment. They also add case notes. It's important to have certain documents in the CAS document check, like a verification of homelessness and ID. For certain programs like PSH programs, they need a verification of disability as well. Let's see. And then the access point providers also need to record a current living situation or another service that is tied to that enrollment every 90 days, or we automatically exit that client from the CAS queue. Next, please. Yep, so like I said, if there's no contact within 90 days just with the head of household, they are exited from the CAS queue, and their family members as well. They could also be exited from CAS and the CAS queue if they no longer need help finding housing. And then the third example of how they would be exited would be if they were actually housed by a housing provider. So we refer them to a housing provider. we see they had an enrollment, and then we see a housing move-in date, then we know it's time to exit them from the CAS queue as well. And our CAS admin is the one who does that. We have a wonderful lady named Stephanie who takes care of that for us, and she has a lot on her plate. She specifically has the CAS admin work group, which gives her access to the CAS queue, where she can do, she can match clients to certain programs, check to see if they're eligible, make referrals to these programs, and then it's up to the programs to either accept or reject the referrals. Then she will communicate with them about rejected referrals. So why was this client rejected? And we can adjust program eligibility as needed. So like I said, the housing provider will accept or reject the referrals. Then they create the housing enrollment program. They manage the client's data via the enrollments and update assessments, annual assessments. They also create case notes and record services for the client, the same way you would any other enrollment.
Thank you, Phil and Frida. Let's give a virtual round of applause to our two presenters for this wonderful webinar that we've had. I want to give a little bit of time for people to ask any questions in the chat. We have a few extra minutes here, so if anyone has questions that they want to ask, whether it be about data governance or anything about capturing client consent and the way they track it, or any of the other specific topics that they were talking about, please put your questions here in the chat. I will give you just a minute, maybe a little less than a minute. I don't know. It kind of depends on. We've got some extra time, but we'll go ahead and wait for a couple of questions. And if not, if we have no questions, then we can sign off early. If I see anyone typing, I'll go ahead and pause. But okay, good. Also, I am going to drop a couple of helpful links here in the chat. Let me just find those really quick. For those of you who are interested, ClientTrack is the case management platform that Dallas Housing Forward has been using. Oh, it looks like we have one. Yes, so South Dakota 500, South Dakota Housing has a similar setup. Do you have a specific consent for review in case conferencing? Stephanie asks.
That is a great question. We do not have a specific consent for case conferencing. It is expected, trained on, and communicated to our providers. There should not be anyone, because we do have case conferencing, and you have multiple providers, right, who are part of that case conferencing. Anyone who's in the case conferencing, they should be an HMIS participating provider. And what is expected is that provider, that person in the case conferencing has gone through all of the HMIS training where we train on privacy, security, and ethics. We do that at the HMIS new user training, and then we reinforce what we call privacy, security, and ethics on an annual basis. And then it is expected that everyone that is in that case conferencing has signed a user agreement as well. So there's no different consent form that is needed for case conferencing. I will just add that just in the last couple of months, our community has integrated behavioral health care within our homeless response system. So all of our neighbors who are experiencing homelessness, they have access to behavioral health care services, and the behavioral health care provider, they do have a different consent form that clients have to consent to, or release of information.
Good, thank you. I'm also, let me see. Oh, right. So just to add some context to Stephanie's question, they say specifically we have external agencies that join case conferencing that are not HMIS agencies. We have a blanket consent at the time of enrollment, but it does not cover all agencies that join in every region. Any context to that, or did you pretty much cover, do you think you covered what they were
I
talking about?
I would just um I am not giving you HUD TA advice. I
Sure.
am just here to share
Yeah.
that in our case conferencing sessions, it is expected that all of those providers that participate in those conferencing sessions are HMIS providers. We've had them to sign a user agreement as well.
Wonderful. Okay. Let me see. Does anyone else have any other questions? I'll go ahead and wait for a second. I just put a couple of links in the chat. Now, remember, everyone, this is part of our ClientConnect series of events that is geared toward connecting communities together, whether or not they use ClientTrack. It's all about just sharing information and best practices. And if you want to pick up some new technology along the way, great, but we're not going to press that right now. So there are two options in the chat. If you want to click to schedule a demo of ClientTrack, you can do so. If you also want to subscribe to our monthly newsletter, wherein we provide, articles about new and emerging trends. We just did an article about combating burnout and social work that we'll be sending out in the next few weeks. We also did another article about self-report data and how to try to mitigate biases that can emerge in that. We're also for ClientConnect, we're doing an in-person event in 2025, early, probably February, we think. So if you want to receive info on that, that is what the monthly newsletter is for. I just put both of those links in the chat. So let me see here. I'm not seeing any other questions, so I think we can comfortably end it here. So thank you all for your participation. We appreciate you for just coming here and being part of this community that we're creating. And thank you again to our presenters. So yes, let's give one final emoji round of applause online. And yes, thank you all for coming in. I will end the meeting here in just a couple seconds. So thank you.